racism in medicine? Of course there is, but most people don't realize where a lot of these folks make lots of money and prey on the indigent, most often people of color in these very high, densely populated urban areas. Here's a story. A cardiologist with poor credentials wants to make a lot of money. Where's he going to go? He's going to go to an indigent area and open up a clinic, a cardiology clinic. Why? There aren't any other cardiology clinics in the area. The payer mix is poor and no one wants to go there. It's very hard to make money and be honest. If you're dishonest, you can make lots of money. Next thing you know, he's doing stress tests and all sorts of exams on people that don't need it. That's because Medicaid doesn't vet their patients. So basically, it's just an open checkbook for these people. Now, here's the story how I came to know about this. Somebody who started working at one of the hospitals I work at told me that she was asked to have an angiogram, a coronary angiogram, but she was young. She had no symptoms. She went to this clinic in one of these areas where she lived. She told me she had a stress test. I said, do you have any symptoms or risk factors? No, I go to the gym. I go to the gym every day almost. I exercise for over an hour. How could it be? Get me the records. The doctor refused. After a month, he continues to refuse until she goes in there and demands the record, because those records belong to you. Now, if the doctor's on my chart and you are on my chart as well, you can get those records, and I really suggest everyone join my chart. But in this case, he wasn't. What did the record say? Well, the record said that the patient walks 1 to 2 blocks and has chest pressure and shortness of breath. Classic symptoms of angina, except she didn't. She had none of these symptoms. Multiply this poor person times 100 or more, and this person's banking lots of cash on these poor, unfortunate folks. Maybe the hospital that he works at is turning a blind eye because, hey, they're making money too. What do you do about that? Well, the patient needs to complain. Now, I've sat with Department of Justice officials in the past, and they're aware of a lot of this, but there's just so much of it going around, it's really hard to police it. So you have to take care of yourself. And this is what you should do. Make the trip, travel, go to a leading center. Maybe it's a bus ride or a train ride away, but don't go into the neighborhood unless you really have to. All the big hospitals usually accept government insurance. They have to. Got it? If you ever have a question, get a second opinion. But really be cautious about these clinics that open up in these underserved areas, especially if they're not affiliated with a major medical center. Tell your friends. Hope that helps.